Hi again, everyone. In this video, I will be walking you through how to complete an integral intake. The integral intake is based on a document that was created by Andre Marquis, and it is to be used in the initial intake interview, and it can either be completed individually by the client, so filled out by the client, or you can use it as an interview protocol to guide your assessment interview. Now, although the DMH, Department of Mental Health initial assessment, is what's most commonly used and what you will absolutely be using if you work at a DMH contracted site, it's helpful to be exposed to different formats that can be helpful when completing an assessment. So this is one alternative. It's relatively straightforward, and it provides a helpful structure to allow you to gather a lot of information in a more narrative fashion. And it gives you helpful questions that you can ask to assess each area. It's broken into sections. First, the presenting problem and psychosocial history. Second, the client's experience internally. Third, the client's behavior, which is considered the exterior, then the client's culture, and then the client's social system. So we'll go over each section in this video and talk about a couple of things to keep in mind. Okay, so first, the presenting problem and psych history. So this section assesses the presenting problem, which is called the reason for referral in the DMH intake. It pays special attention to what brought the client to services now. So if you think about it, the client has likely struggled with some of the issues that they're bringing to therapy for a long time. So this section is trying to find out why they're seeking help at this moment, and also why they've sought help previously, if they have. So what makes now different? Why at this moment have things gotten worse? Has your motivation increased? What are you in, like a different stage of change? Those kinds of things which are helpful to know. And it also begins the psychosocial history. So let's look at it in a bit more depth. Here are the first couple of questions. And I'll basically read through them, offer a bit of explanation where necessary, talk about why it might be helpful and what it's addressing. So first, what is the primary concern or problem from which you are seeking help? So this is your typical, like, what brought you to therapy question, and it can go in lots of different directions. Now, what the client identifies as what brought them to therapy will tell you kind of which sections you're going to need to pay close attention to. So if they say that they came in because they're having panic attacks, you know that you're going to need to assess a bit deeper in the anxiety symptoms. Question 2, what makes it better or what makes it worse? So this is starting to assess for strengths, coping skills, and triggers. And these will be helpful to keep in mind for when you get to crisis planning, okay? If the client tells you nothing makes it better, then maybe you can start to explore with them, was there ever a time when they felt better? And go from there. Mm-hmm. Number 3, are there any immediate challenges or issues that need our attention? This is starting to get at some of the crisis screening. You'll get into that in a bit more depth later. Have you had previous counseling or psychotherapy? If yes, you want to find out what was that experience, so question 5. And then question 6, what was most helpful, least helpful? Question 7, what did you learn about yourself through your previous therapy? This is really helpful so that you don't reinvent the wheel. If something really worked well for the client and help them to build some insight, you want to build off of that. And so getting more detail about that is helpful. Likewise, if they really didn't like something, that's useful information to have as well. It either tells you that it's a technique you're not going to want to try, or it tells you that perhaps there's some resistance to this particular area or this particular type of work that you'll need to be mindful of. And then question 8 here, what do you expect from me in our work together, is a really helpful question. Part of informed consent is making sure that the client knows what they're getting into, right? And we need to know what they expect to get out of us so that if they're saying, well, I want you to tell me whether or not I should get a divorce, you can let them know from the very beginning that that's not something that you do, and not set yourself or the client up to be disappointed in therapy, right? And to turn them off from therapy. Okay. The next section is the experience individual interior section. This section is orienting you to the person themselves. You haven't yet gotten into the exterior, the social, that's toward the end. This section is going to go into depth with some of the topics that were briefly addressed in the first section. So things like the crises and the coping strategies, for example, but with more detail. This is also a helpful reminder that if your client answers you about, say, a crisis, and they say, yes, I'm feeling suicidal, for example, you're not going to want to say, okay, thank you for telling me. Now the next question is, and go somewhere completely different, right? This should be more of a conversation than an interrogation. And so if there's something that they seem like they want to discuss further, you're going to want to attentively listen and encourage that conversation. And this requires that you be familiar with your assessment tool. So with that, I feel suicidal question or response, you know in your integral intake that there's a question later on that asks about suicide. And so you gather all that information and you fill it in the relevant assessment section later, as opposed to skipping over it and saying, oh, we're going to get to that later, which can interrupt the flow of assessment. So being really familiar with your assessment tool is really helpful to create more of that conversational narrative that's more comfortable, as opposed to just like spitting out questions. Okay. So we're going to get at emotions, strengths, pivotal memories, crisis issues, coping strategies, potential traumas, lots of stuff in this section. It's definitely one of the longer sections. All right, so here, a lot of these are pretty straightforward. What are your strengths, weaknesses? And then elaborating on those, what kind of things do you do to hone in on those strengths? Like if they say they do art, well, what kind of art do you do? How often do you do it? So taking a stance of curiosity to find out more information. How would you describe your general mood and feelings? Again, this can give you a clue for diagnostic purposes later if you elaborate more on it. What emotions do you feel most strongly? Kind of the same as number 2. What are the ways in which you care for and comfort yourself when feeling distressed? This is really helpful for building up coping strategies. So you want to make sure to get information here. If they say, I read books, okay, what kind of books do you read? What is it about reading that helps you? How often or how long does it take for you to read before you start to feel better? These are vital pieces of information that you can then pull from if you're making a safety plan, right? How do you deal with strong emotions in yourself? If they say something like, I hit things, then that clues you in that you need to now assess for aggressive and potential homicidal ideation stuff, right? So you wouldn't then say, okay, you hit things. Now, how do you respond to stressful situations and other problems? That is not validating at all to what the client has just shared with you, and it's not taking a stance of curiosity. So elaborate more. You want to know more. You want to understand what makes this person tick. You want to understand what this person is bringing to the table, who they are. And the only way to do that is to ask further prompting questions. Okay? How do you make decisions? This is helpful to determine how much autonomy the client feels and perhaps give you a bit of a hint about how much dependency they're going to place upon you. Okay? If they say they really struggle with decision making, that's a clue to you to not take an overbearing approach in therapy that may make them become dependent upon you. Next, in the individual exterior section is more explicit crisis screening. So there are questions here about recurring images or thoughts that could include nightmares, for example, attempts to harm the self, kill themselves, harm or kill others, present suicidal ideation, and any trauma. Now, a quick note about the question with the asterisk here, number 4. This question actually comes later in the assessment, but I would lump it in here and do it in this order because it flows a little more naturally in this case, because you're already asking about potential crisis situations, and these traumas can also be crisis situations for the client. So I would include them here. Now, remember, of course, that when you're getting to this section that you would ethically want to remind the client of your mandates for reporting and the limits of confidentiality so that they can take a fully autonomous decision in deciding whether or not to tell you about these things, okay, knowing that you may have to break confidentiality if they say that they're suicidal or if they say that they are homicidal, for example, okay? In the case of a crisis, by the way, so if the answer to number 3 is yes, I'm currently suicidal, the assessment for everything else essentially stops in that moment, and you assess the crisis and then intervene. Okay, next is family history, which is still part of the individual interior. This is getting a little bit at some of the mental health history in the family. So has anyone in your family ever attempted or committed suicide? It's getting at potential stressors in this next one: illnesses, births, deaths, losses, change in the family. And then we're starting to get at some more past history information here, potentially some trauma information with your earliest, happiest, and most painful memory. These can be somewhat difficult for clients to share, so definitely take that stance of curiosity and ask them to elaborate more, right? When they share their happiest memory, what made it happy for you? Have you experienced that sense of happiness again? Those are helpful questions. When they share their most painful memory, validate the pain that they felt, use their words to describe the feelings that they felt, and ask them to elaborate if necessary. Next in this section is coping and strengths. So where in your body do you feel stress is getting at some of the somatic symptoms. Some folks may say that they feel tension in their shoulders and in their head, that they feel nauseous. Those things are helpful and are a good reminder also to make sure that the client has seen a primary care provider recently and had a physical workup. Do you have any ways in which you express yourself creatively and or artistically? Is obviously getting at coping and strengths here, things that you can pull upon to use in therapy. Okay, if they say that they do sports, this can give you a hint that they're physical and that this is something physically active, and that this is something you might be able to use as a coping strategy, for example. What do you enjoy about sports? Do you like, independent sports or team sports? When was the last time you played? Have you found that playing sports helps you feel better when you're down? Those are all great questions to elaborate on. Describe your leisure time. So you're looking at what does the client do in a given day? And you can get really specific with this. Like, tell me from when you woke up yesterday to when you went to sleep, what did you do? Okay. And this can give you some hints about whether this person is isolating, whether they're social, whether they are, working, seeing friends, family, and so on. It could be a lot of really helpful information. Okay. All right. And then in the last section of the individual interior component, we're getting at mood and life satisfaction. And here we're just checking things off. Now, what's important here is you'd want to have been attentive up to this point about what the client has been sharing. If they've already communicated that they felt lonely, for example, in the painful memory section, you wouldn't then ask them, have you ever felt lonely? Because you already know, and this may make them feel like you weren't listening. If you wanted more detail about that loneliness, you could ask something like, you mentioned earlier that a past memory left you feeling really lonely. Can you tell me about other times when you felt lonely? Right? If they haven't addressed any of these, you could start the question off by saying, I'm going to list off a couple of feelings and experiences. Let me know if any of these resonate with you, and then going slowly through them. Or you can say, can you list some of the feelings that you experience most regularly in a given week and see if any of these come up. Okay, so you can be creative with these instead of saying, have you felt angry? Have you felt sad? Have you felt lonely? That is boring. Don't do that. All right, the next section, behavior, individual, exterior, is assessing physical health and substance use history for the client. Note that some of this section does get into far more detail than we might necessarily need as MFTs, so it would be appropriate to skip some of the questions. For example, I would skip the question that asks about use of nutritional supplements and vitamins. This goes a bit out of my scope of practice and isn't super relevant to their mental health, so I would probably skip that one. Also remember that your focus is on understanding any physical issues that may be contributing to or have contributed to mental health issues. So keep that lens that you're looking at this from. You're not doing a physical. You're finding out, are there any physical issues that might be making the mental health symptoms worse, right? Are there any physical symptoms or issues that started the mental health issues? Those are the kinds of things that we're looking at. And also, are there mental health issues affecting their physical health now? Okay, so use that lens as you go through these. And if some of these questions don't feel important, you can skip some of them. All right, so first here, I will say that these are pretty helpful. So list any medications you're taking. I hone in primarily on the psychotropic medications, but you could ask for all of them. Do you have a personal care physician? When was your last physical? Super important to ask about, especially if you have elderly clients. Have you ever suffered a head injury or other serious injury? This is important because some of the symptoms associated with that type of injury could look like mental health symptoms, so you want to find out. And other significant medical problems you've experienced or are experiencing, again, from the lens of how they may affect mental health issues or how mental health issues may be affecting these physical symptoms. Okay, in this next one, we have another check off section. And I will say that some of the wording here is problematic. So when asking, I would modify a few of them. So for example, for the second one that says use illegal and or mind-altering drugs, that might carry some shame with it because of the word illegal. So I might say something like use any kinds of drugs or substances, right? And remember that you want to normalize some of these things, right? So instead of saying drink too much, you might say, tell me how often you drink, and then go from there. Same thing with eating too much, eating too little. Tell me about your eating habits, might be a better question. Or do you feel that you don't have as much control over your eating habits as you'd like? Things like that, that normalize things a little bit better. You could even say sometimes when folks are feeling really stressed, they tend to eat too much or eat too little. Is that ever something that happens to you? And that normalizes things a little bit more. Again, also, if you're familiar with your tool, you would know that a few questions down, you have a question about drug and alcohol abuse, which we'll get to later. So if you get that information now, you won't have to bring it up all over again in a few minutes. So if they were to tell you, I drink every day, you would then do your substance use assessment. You wouldn't wait until later in the assessment where it asks you more explicitly about those issues, because you already know your tool and you can do it now when it feels a bit more natural. Okay. Just like with the other one, you wouldn't say, okay, do you neglect your friends and family? Do you neglect yourself and your own needs? Not helpful, kind of shaming. Make it conversational. Tell me about your relationship with your friends. Tell me about your relationship with your family. Is there anything that you'd like to change in your relationship with your friends or your family, right? More conversational. All right, next section is the culture collective interior. So here we are getting a bit more external now, okay? There are some Likert type scale questions in this about comfort in social situations, religion, relationship satisfaction, and so on. And these are pretty straightforward. You basically just circle from 1 to 7 based on what the client expresses. So I'm not going to go over those. But of course, you do have access to the integral intake on Canvas, and you will have a chance to look at it when you complete your mock client intake form. So if you have questions about any of those, please feel free to reach out. Okay, so here are the questions for this one. Describe your relationships, including friends, family, and coworkers. Remember when we were talking about assessment tools that you don't want to lump all of these together, so do one at a time. So describe your relationship with your friends, and then use your sense of curiosity to find out more information. Then when they're done, describe your relationship with your family, and so on. What's important and meaningful to you is fairly straightforward. Another way to ask that, what are some things you're passionate about? What are your goals? What are your dreams? What are your hopes? All of those would be valid questions. Which emotions were encouraged or commonly expressed in your family of origin? Which emotions were discouraged or not allowed? These are great questions, which give you some hints about what they are bringing to the table in terms of their emotion. If an emotion was suppressed, like anger or sadness, it's very likely that that's how they're going to manifest to you. They're going to be uncomfortable with their sadness or anger, and so that's helpful to know. Which emotions are most comfortable or uncomfortable for you now? I really like how this question's worded because it doesn't say, that feelings are bad or good, but legitimately some feelings are uncomfortable and some are comfortable. So this is a great way to word this question. How do you identify yourself ethnically, and how important is your ethnic culture to you? Remember, in the legal and ethical section, we talked about how we want to show sensitivity to culture, right? And not assume that we know everything about a person just by looking at them. So this is a helpful question to find out about their ethnicity. And you could add to this, tell me how you identify yourself in terms of gender and how important that is to you. And the same for other social group identity memberships. So this could be a nice guide for assessing those things. All right, these questions here get at love and care and disapproval from family of origin and current family. These can be helpful to figure out love language, to figure out past hurts, to figure out who the person has positive relationships with. So these are great. Always take a stance of curiosity. If they say my family expressed love and care by buying me things, you could follow up by saying, did that feel affirming for you? Do you express love and care that way? Tell me more about what those gifts, receiving those gifts felt like for you. Okay, those are all good questions. Describe your romantic relationships if you've had any. Sex life, beliefs about sex, great questions to ask, not just when you're working with couples. These are great questions to ask your clients regardless of whether you're doing individual or couple, because these can be big issues for people. Religion and spirituality, for the first two, do you have a religious and spiritual affiliation or practice? What beliefs do you have about religion and spirituality? We know that religion and spirituality can be really great coping strategies. And folks that are religious or spiritual do tend to have more access to supportive groups of people. So that's helpful to know. Also, though, we don't want to forget that in some cases, religion and spirituality can be very toxic, especially if their religious or spiritual group discourages seeking out mental health treatment or shames those who do. So this is important to find out. And we want to make sure we don't bring our biases into this question. So an open-ended question like this is helpful. What beliefs do you have? Okay. What are some of your morals? Pretty straightforward. I would maybe follow up with, how do you show that moral, right? If they say one of their important morals is family, okay, how do you act that out in your life? Political civic engagement could be helpful if you think that would be important to find out. Environmental activities, cultural activities, institutions. Question 5 and 6 are also touched on later in the social section. So again, helpful to know that. So if you get into it here, you don't necessarily have to bring it up again later. And then, have you ever been a victim of any form of prejudice or discrimination, or felt that you were disadvantaged in terms of power or privilege? I would split these two questions, okay? But this is a great question to ask. This is getting at the potential issues with diagnosing, right? And how we often can misdiagnose or pathologize behavior that is really the result of discrimination or lack of power and privilege. So this is great to find out more about. And to really understand what that experience has been like for the client. Okay, the last section is social systems, collective, external. So this is getting at the social, the outer environment, if you think of like Bronfenbrenner and the different systems. So we're looking at the outer systems now. So describe your home environment, your social home environment, your neighborhood, work environment, partner, pets. Great questions, pretty straightforward. With the physical environment, we're kind of screening for any poverty issues, homelessness, things like that. With neighborhood, looking for things like resources, community engagement. We know that things like social cohesion or the connection between neighbors is helpful as a protective factor. So finding out more information about that. Do they feel safe in their neighborhood? If so, why? If not, why not? Social home environment, that interaction, the relational piece. Work environment, do they interact with colleagues? Is it a stressful job? Is there mobility? Do they have employment goals? All great questions to ask about in this one. Romantic partner, if you got at that already in the earlier questions from the culture section, where you talked about relationship history and sex life and that kind of thing, then you already have some of this. And then do you have any pets? Just a helpful thing. For many folks, their pets are their family, and this is important for you to know. Military, custody disputes, legal system, some things that may not apply for your client, but are helpful to know if they do. If they have served in the military, then that's a clue for you to assess for PTSD. If they're involved in a custody dispute, then you want to go over things like subpoenas with your client and the potential that your records may be requested in that subpoena and what risks are associated with that. Same thing with number 3. What aspects of your life are stressful? This is helpful to know. Even positive events can be very stressful and can manifest in mental health symptoms. So we want to find out about that. And what kind of social support do you have or people that help you in times of need? Also very helpful for crisis planning, for treatment planning, also for assessing just relationality, how well they get along with people, and if their mental health symptoms have begun to impair that area at all. Very helpful things to ask about. Here, we're getting just some general information about who is in the family of origin and who is in the current family at the bottom of this. Educational background, occupation, and income, helpful things to know just to get a more holistic understanding of this person and what they're bringing to the table. And then here, family history of mental illness is helpful. We know that certain things tend to run in families, and if they don't, they can still bring stress associated with them, right? So having a parent who was severely depressed, for example, likely influenced the client growing up. So we want to know about that. And remember, I mentioned organizations and volunteer work. We're going to come up again. Here they are. If you didn't happen to get them in the other one, or you didn't ask specifically about organizations or volunteer work, here's your chance to do it, to find out what their interests are, what they're passionate about, and potential things that can help you. All right, and then here, another one of those check ones. And this is asking if the client has experienced difficulty or problems with any of these. And if they have, you then write the approximate age when this happened, okay? Some of this stuff they may not know. They may not know if they experienced any trouble when they were infants, for example, with toilet training. If they don't know, that's okay. And again, you want to try to make this as conversational as possible. These are a bit harder to do that with, so you could preface it by saying, I'm going to find out a little bit more about your development. So I'm going to ask you some questions about developmental milestones and other things that you may have experienced growing up. If they don't feel relevant to you or you don't know, that's okay, we can skip them. Okay, and then you can group them into age. So in infancy, did your parents ever tell you that you were difficult to potty train, or that you crawled or walked faster or slower than other kids? Right? So trying your best to make these conversational. And then in the next section, when you started school, what was that like? Did you make friends easily? Tell me about how you did in school. Things like that, more general. Okay, and so on, you'd work your way through. Okay, and then this last section here is getting at sub-personalities, which the client may be confused about, and that's okay. If none of this resonates with them, it's okay. But you're asking, and I think reading it is the most helpful, honestly. So you could read this out to them. So I'm going to give you a list of sub-personalities that many people notice in themselves in certain situations, but not in others. Let me know if you've experienced any of these or difficulty with any of these. And this may be only evident to you after you've noticed that you were behaving or thinking or feeling in a weird, strange, different way. So did you ever feel like an irresponsible child? Did you ever feel like the critical parent? And just kind of going from there. And if they're looking at you like, this maybe isn't the thing for them, it's a little bit too heady for them, and move on, okay? You'll get at this stuff in the process of therapy. And then the last one, is there anything else you want me to know about? I also like to ask, is there anything that I missed that you really think is important for me to understand who you are? Or anything that you want to elaborate on? Okay. Great way to end. Nice way to get any last pieces of information or any things that the client really thinks are important pieces of themselves that you maybe didn't touch on or didn't elaborate fully enough on in this section. Now, as you noticed, this is a long assessment, and so I would recommend that when you're using this, if you elect to use it, that you do so over multiple sessions as opposed to trying to cram it all into an hour or 2 hour session. After a certain amount of time working with a client to do an assessment, it gets draining. So it's best to try to spread your assessment sessions, regardless of whether you're using this or the DMH assessment, into multiple assessments. It helps with building rapport, it helps give them a break, and you get to start each day fresh. If you are doing that, I encourage you to end your assessment sessions each week or each session on a positive note by talking about strengths, talking about interests, talking about passions, so that they leave feeling good and are looking forward to the next session with you, as opposed to processing the trauma that you just made them relive. Just a little piece of advice. All right, so reach out if you have any questions or you want clarification about anything, and I'll see you next time. Thanks, everyone.